in true Manova style, we have a very unannounced special guest that we're really pleased to have. Somebody who's been a partner to the health community here, the health community in the United States, and globally. Would you please join me in welcoming our very senior Senator Amy Klobuchar. Great.
Thank you. Thank you so much, everyone. Thank you. Thank you so much. Thank you so much. Did he almost accidentally say Minnesota's own senior citizen? I think he did. I have had that happen before. But in fact, I'm the senior senator. And I know there's people here from all over the country. I want to thank Medical Alley and Mayo Walmart for sponsoring this, and everyone who is participating in this incredibly important summit. For our out-of-town visitors, we do welcome you to Minnesota, where you will find the biggest shopping mall, the Mall of America, the world's largest ball of twine, and we're the state with the world's second biggest hockey puck. Okay, Canada has the biggest one. And of course, the world's only museum completely devoted to Spam. It's in Austin, Minnesota, and we call it the Guggenheim. So Minnesota is, as they say, a good place to get sick in. We are home to some of the world's top research labs and leading health businesses, from Mayo Clinic to Medtronic to GM, United Health. I could go on and on. And we are also a major mecca of innovation. And in one direction, you know, America is sitting somewhat idly with sputtering research budgets, healthcare workforce shortages, and a slippage from our spot at the top of the world's high-tech hierarchy. But there's another road where we continue to have incredibly innovative companies, breakthrough cures, the best scientists, the best research universities. And I just want to keep us on that path. And it is ironic to be here at a conference on collaboration, having just left Washington. Wasn't the most collaborative week. But I, after being home for about 2 days and getting to watch our marathon runners, I was at mile 23. They were still going strong. And getting up to Duluth today, there is still a lot of optimism about America and positivity out there. And I am not going to really focus on everything that's wrong, because I think that's why you're here. You're really well aware of all of our challenges. And I am also not going to focus on some of the bread and butter issues I usually talk about, which is improvements we should make to the Affordable Care Act with reinsurance and some of the cost-sharing work, and the bill that we have out there called the Alexander Murray bill, named after two of my colleagues that we're trying to get done. Or even on pharmaceutical prices that I've worked on very, very hard over the last 10 years. But what I want to do instead is to focus on solutions on the research and innovation front. And I would say, first of all, if the future health of the U.S. lies in medical research and innovation, then medical research and innovation must have a future in the United States. The first challenge is, of course, resources. And if we're going to make artificial kidneys, if we're going to map the human brain, we need research. You think about Mayo and how Mayo got started. In 1850, William Worrell Mayo had the chance to use an amazing new invention called the microscope. And Mayo never forgot the promise of this new technology. Dr. Mayo knew that the gains he would make by investing in new technology were far greater than the cost, and that still is true today. And this investment has real implications. You look at the discoveries arising from NIH-funded research, which provide a foundation for the U.S. biomedical industry, contributed $69 billion to GDP last year, and supported 400,000 jobs. As you know, these are good paying jobs and jobs that we want to add not lose to international competition. That's why I have consistently supported NIH research. In fact, during that shutdown years back in 2013, I was the only senator to make a point to devote my salary during the shutdown to the NIH Foundation because I wanted to make the point that people were losing out on life-saving research experiments, and other work was just stopped dead right there, and it had a real impact. We have since then continued to come together in the area of research, including passing the America Cures Act, which I was really proud that we got done, and adding more money for research even in the last year. So that's going to be a big piece of this, and making sure we always have that bipartisan support for medical research. The second thing is public-private partnerships. Our research dollars go further when there's a partnership. One example, in the pharmaceutical industry, a $1 public investment in basic research is estimated to lead to an additional $8.38 of private research and development funding after 8 years. Take the Biomarkers Consortium, a research partnership managed by the Foundation for NIH. It's working to establish biomarkers or signals that our bodies send that can tell us if we are at risk of developing a disease. And we know that cholesterol and blood pressure are good indicators of cardiovascular health. Identifying biomarkers for other body systems will enable researchers to discover technologies for the diagnosis and treatment of diseases. Public-private partnerships aren't limited by our country's borders. Grand Challenges in Global Health Initiative, a major effort with NIH and the Bill and Melinda Gates Foundation, aims to achieve breakthroughs in 16 major global health challenges. I'll never forget being in Africa on the first ever women's senators trip to Africa, and we went out on a Jeep 3 hours out from a smaller airport and got to visit a village in the middle of nowhere, and one hut that was the woman who was a widow was there with her 2 little kids. She had no light, no electricity. She had a small plot of land that she grew teff on, and there was nothing in this hut except the solar panel that she had gotten because she had been a leader in the Gates Foundation's initiative. And there was nothing on the wall, but the solar panel allowed her to the kids to do their homework at night. And we looked at her in a typical senator fashion and asked this question, which was, what is your biggest challenge? And this is someone that walks an hour and a half every day to get water for her family and walks back, has no one else, no adult in the house. And she looked at us and says, challenge? I don't have a challenge. And she pointed to the Gates Foundation. The only thing on the wall was a global health chart with her hut in the middle and the other huts, and with little stars and stickers showing if they were getting their baby well exams, if their mothers were going in, and if they were getting hygiene the way they were supposed to. And she was in charge of those 20 huts around her. And she said, I have no challenges, I am a leader. So that is what these kind of global health initiatives are all about, that if you get people to that place where they not only get healthier, but they lead and they learn, especially women, you can change a whole society. Solution number 3. Solution number 3, revolutionizing patient care, and that is really looking at how we provide patient care. And you know all of this better than me, understanding the mechanics of disease, the challenges facing our healthcare system. So it isn't just about new cures and research, it's about what works best. I would have liked to see more in the Affordable Care Act. I got my Quality Care Index in there, and of course states and healthcare systems that reward quality tend to cost less in the long term. New initiatives, including paying for services in innovative ways, like revising Medicare's fee-for-service system with single bundled payments. I know my friend Andy Slavitt worked on so many innovations like this one while he served as acting administrator for the Centers for Medicare and Medicaid Services. For example, if a patient undergoes surgery, payers would traditionally reimburse, as you know, the hospital surgeon and anesthesiologist separately for their treatment, and with the bundled payments, the payers can collectively reimburse and try to do things in a more affordable way. That is something that we want to use more. Technology, another powerful tool. The Center for Connected Health, which is a project of Partners Healthcare in Massachusetts, is developing ways to use remote monitoring, telehealth, and online communications to give patients the power to better manage their health conditions outside the traditional medical setting. The Center for Connected Health knows that an engaged patient is an informed patient, and we've seen how that can save money. One example, one solution, the center's Connected Cardio Care program has already saved more than $10 million since 2006, caring for more than 1,200 patients. We also can't limit our solutions to those within our own borders. I'm not afraid to look at other countries. France has dedicated $2 billion to caring for people with Alzheimer's, taking a comprehensive approach. In addition to training doctors and nurses, France offers support programs for families, adult daycare, for patients, and coordinating centers. These are the kinds of things we have to look at as we look at this, what we call, I used to call the silver tsunami of the doubling of the senior population, but then some of the senior groups told me that was too negative. So I now call it the silver surge. But as we see this silver surge, and we have given this gift caused by so many of you, a gift, and that is that people are living longer, we're also seeing more and more people with Alzheimer's and dementia. And that has got to be a focus not only on the cure side, but also on the care side. Fourth solution, more STEM education as we look at how we're going to be innovative going forward. And we know that currently about 1 in 3 American university students earn bachelor degrees in science and engineering. In Japan and China, more than half do. As former President Obama once said, the country that out-educates us today will out-compete us tomorrow. And so we need a much greater focus on STEM in our K through 12 classrooms. This is another area where there's a lot of bipartisan support in Washington, and I think we have to keep that going. And that's also, by the way, I head up the high-tech diversity caucus in the Senate with Senator Scott, and we are really focused on trying to get more women and people of color into these fields because we don't have enough workers in these fields. They're some of the most high-paying jobs, and that's got to be a lot of what we do as well. So we don't have any more hidden figures, right? We have people, that was the movie, people who are out there doing the work in these areas. Solution number 5, one of my favorite ones for the healthcare field, immigration reform. Now, this has kind of taken a turn. That's a nice Minnesota euphemism. In the last 2 years from the bipartisan support that it once had, and I know we've had a major change with this administration. No one knows it better than me. On Inauguration Day, I was officially displaced as the most famous Slovenian American in Washington by none other than Melania Trump. She was born an hour away from where my relatives are from in Slovenia. And as I said at the National Prayer Breakfast, every time I look at her, it's like looking in the mirror. But in any case, the president was sitting there and laughed when I made that joke, just to make sure. It has been really hard for those of us that want to work on immigration reform, sort of with the new rhetoric coming in, because in my state, where you are right now, we have 2.9% unemployment. It is even lower in some of our areas, in our rural areas, and real issues in the healthcare field at some of our rural hospitals, and trying to staff up manufacturing, including medical device manufacturing, can be hard when you have that low unemployment rate. So yes, some of it is apprenticeships and getting kids into the right careers and doing that in middle school and high school. But another big part of it is immigration reform. And I always like to argue for comprehensive reform and a path to citizenship, I like to argue the economics of this. 70 of our Fortune 500 companies are headed up by immigrants. Hundreds of them are headed up by immigrants and kids of immigrants. U.S. Nobel laureates 25% of U.S. Nobel laureates were born in other countries. Immigrants don't diminish America, they are America. So that is a lot of the argument for what we need to do if we want to keep this innovation going and this talent coming in. Is not to shut out the world's talent. And that's everything from the Conrad 30 program. I head up that bill now after Kent Conrad left the Senate, and that's trying to get doctors who get their degrees from medical schools in the United States to allow, not force them right back, the last thing we want to do, but allow them to stay as long as they go to rural or underserved areas. And we don't want to just keep that program in place. We want to expand it. And then it is also, of course, getting workers in the fields where we need them, not just in the farm fields, but in the fields of technology. I just made that up. That was pretty good. In the fields of technology and medical and other places that we need them. So those are just the ideas that I think could help us, in addition to probably much more complex systemic ideas. You guys have been talking about at this conference, but these fundamental things that we should be doing in Washington to continue our premier place in the medical research field internationally, to continue finding cures, to continue employing people and being in the lead to get that precision medicine, which is so promising at Mayo and at other incredible universities and hospitals all over our country, to make that work for people. We're going to have to continue to have the workers that can do that. So in the end, how I think about this is that it's about making people's lives better, giving us hope when hope seems lost. A few years ago, I met with a little boy named Jackson. He was diagnosed with muscular dystrophy at age 5. He loves sports. He loves art. And his mom said this to me. She said, "We're at the starting line. We're ready. The researchers are ready. And Washington is slowing us down. Every day matters. It really matters. Hours matters. The longer it takes, that's fewer days for Jack." So if we're going to be leaders in medicine, if we're going to find the treatments and cures that kids like Jack needs, then we can't let anything prevent us from moving forward. I invite you, by the way, I invite the entire state of Minnesota for breakfast whenever the Senate's in session. In my office on Thursday morning, we serve a Slovenian treat called petitza. And you're welcome to come, because when you come into our office in the front lobby, you'll see a picture that I have on the wall. And it's a picture of an angel, and she's handing off a globe, the world, to some outstretched hands. And the words read, "In my dream, the angel shrugged and said, 'If we fail this time, it will be a failure of imagination.' And then she placed the world gently in the palm of my hand." So knowing the work that goes on in my state, medical device, and in the healthcare field, I'd say the future of health is in good hands. And all we need right now, and what I hope you will be bringing to us with this first summit here in Minnesota and many more to come, is the imagination that we need, and certainly that Washington needs, to take that step to best support you and the work that you're doing. So thank you so much. It's been an honor to be here as the senior citizen/senator. And I am now very honored to turn this over to Angelica Lavito, who is from CNBC, and a stellar lineup of trailblazers delivering care that you're going to hear from today. Thank you so much, and thanks for coming to Minnesota.